27 years ago, I had surgery. The surgery did not go as expected. I was told I would be in the hospital for 2 or 3 days with a sore neck for a month, and I woke up quadriplegic. I spent 6 weeks in a rehab hospital, was sent home in a wheelchair, learned how to walk again after about 3 months. 2 years ago, I slipped in a restaurant and fractured my fibula, and that pushed the pain in my right leg to just extreme levels. I have extreme neuropathy in my bottom of my right foot, and it's burning all the time. And I have neuropathic pain that's pulsing through my right hip. For the 27 years, it has never shut off. Well, as a young man, I was a dancer, and then when I stopped performing, I was a marathon runner. Day before surgery, I ran 5 miles. And so to lose complete control of my body and become paraplegic from the surgery was life-altering. Sometimes I'd be depressed. Sometimes I really thought, no, I don't know if I can keep doing this.
Patients relate stories of not being listened to, heard, or validated by their providers, being shuttled between specialists and other specialists and centers and other centers, and continue to get medications that may actually make their pain worse.
The traditional medical approach to chronic pain is to treat a symptom, and the symptom is pain, but that's about 1/1000th of the experience of chronic pain. The Comprehensive Pain Program arose out of our awareness that our approach to working with folks who have chronic pain was not effective. The most common approaches that have been used to treat chronic pain are medical. They're pills, they're procedures. The repertoire, the toolbox is very thin. What we're trying to do is open that horizon so that we give folks all the tools they need to frame the experience of chronic pain, therapies that can help address their level of comfort and help them do the things that are really important to them in their life. The program is designed to take individuals who are experiencing chronic pain, provide them with an unconditionally supportive clinical environment that is as non-clinical as we can make it, provide them with access to therapies that we know are effective from a variety of heritages and disciplines, provide them with a community of fellow travelers through the 16 weeks of the program, and work to get to a place where they're able to assume agency and efficacy in working with the experience of chronic pain.
It's been life-changing. There is kind of a holistic approach where it's not just treating the pain, it's like dealing with the whole person, dealing with me, and it's like, okay, let's look at your diet and let's look at the nutrition things and what's anti-inflammatory, what kinds of things would be good for that. And okay, well, you don't have to always give up all coffee, but a little less coffee might help. I do yoga, acupressure, acupuncture, we do Reiki. I feel like the whole team carries me along.
The costs of care, the costs of medicine are significantly lower. The use of the emergency room post-program drops by almost 70%. The important piece of that for us is that there's much less suffering after the program.
One of the things that providers have told us is they need to have other insurers, and particularly Medicaid, on board with this program. So the commercial insurers we've been working with have studied this program ever since its inception and have done both 1-year and 2-year analyses and shown significant savings for them and for their members and ultimately for premiums. Medicaid became interested in the program to improve the quality of life for their members, but also to save costs. Vermont State Medicaid, they're the first state Medicaid agency that has invested time and energy in building a pilot to include a pain program which includes integrative services in a multidisciplinary format.
I am extremely grateful for this visionary design of integrative healthcare and to the insurance companies understanding lives can be improved and ultimately dollars saved long term. And rock on Medicaid for joining into this program, because it increases access to this extraordinary level of care. Bravo. So I have benefited tremendously, and I thank you all for your work. I'm 70 years old, and I've never had this experience.
To feel more whole, less broken, more filled with joy is a very special gift.